So RTOG 9601 was a phase 3 trial, and the results from this trial were reported a few years ago in the New England Journal of Medicine. And this trial randomized 760 patients who had PSA recurrences after surgery to either the standard of care at the time, which was salvage radiation with placebo, versus salvage radiation with bicalutamide, which is an anti-androgen therapy. The trial was positive for its primary endpoint of overall survival, and actually changed the practice of salvage radiation for prostate cancer patients in the sense that it led to a recommendation from the AUA and ASTRO and other national committees that hormone therapy should be offered with salvage radiation for patients with PSA recurrences after surgery. While RTOG 9601 showed a survival benefit with the addition of bicalutamide to radiation, it's clear that not all patients benefit from the addition of bicalutamide to radiation. And so looking at a variety of clinical parameters, some of my colleagues at NRG Oncology have found that patients with higher PSAs may be the ones that benefit from the addition of bicalutamide to radiation. Patients with lower PSAs may not see as much of a benefit. But even in the patient population that has lower PSAs, this is a very heterogeneous patient population, and it's likely that some of these patients might actually benefit from anti-androgen therapy and some others might not. So we actually recently performed a study where we applied the Decipher platform to samples from the RTOG 9601 trial. And so we were able to obtain about 350 samples, and we were able to assess Decipher score on those samples. And what we found was that, number one, Decipher strongly predicted for which patients developed distant metastasis, which patients died of their prostate cancer, and actually was a strong predictor of overall survival as well. And the ability of Decipher to predict these endpoints held up even when accounting for standard clinical and pathologic variables. Now, what was interesting about the Decipher study is that we also looked at which patients specifically benefited from the addition of anti-androgen therapy to the radiation. What we could see was that patients with low Decipher score derived very little benefit from the addition of anti-androgen therapy to the radiation. Patients with high Decipher score derived substantially more benefit. And the reason why this is important is that given the ASTRO AUA guidelines to add anti-androgen therapy to salvage radiation for patients with PSA recurrences, what this new Decipher study suggests is that perhaps Decipher can be used better to personalize therapy within the setting in the sense that, at least in my practice, if a patient had a low PSA and a low Decipher score, I would be less apt to offer anti-androgen therapy with the radiation. If they have a high Decipher score, I would be much more likely to recommend giving the anti-androgen therapy with the radiation. Now we actually have data in looking retrospectively at a phase 3 trial that validates or confirms the prognostic power of Decipher in the setting.